Assalamu alaikum. Hello everyone, my name is Amna and welcome back to my YouTube channel. As a pharmacist, I'm very passionate about sharing my knowledge and expertise with you through this platform on this channel, and you can expect to find more videos about a variety of topics related to pharmacy and much more. I also want this channel to be a space for engagement and discussion. So if you have any question or suggestion for future videos, please don't hesitate to leave a comment and send me a message. Thank you for joining me on this journey, and let's get started. Which of the following is decrease gastric empty rate? Metoclopramide, tropin, hypothyroidism, and B and C. So the correct answer is D, B and C, atropine and hypothyroidism. Both decrease gastric empty rate because like metoclopramide is a prokinetic drug that increases the gastric motility and accelerate gastric empty. So it does not decrease gastric emptying rate. Atropine is an anticholinergic drug that inhibits the parasympathetic nerve activity, including the nerves that stimulate gastric emptying. Therefore, it decreases the gastric empty rate. Hypothyroidism is a condition where there is insufficient production of thyroid hormone, which can cause a variety of symptoms, including a decreased metabolic rate and gastrointestinal motility. This can result in a decreased emptying rate. Therefore, the correct answer is option D, tropin and hypothyroidism, atropine. 2. Which one of the following is not alpha-2 agonist? Clonidine alpha, alpha-methyl noradrenaline, non-selective act on and beta-1, alpha-1 and alpha-2, guanfacine, guanabinz and guanethidine. So the correct answer is guanethidine is not alpha-2 agonist. Guanethidine is not alpha-2 agonist. It is antihypertensive drug that works by blocking release of norepinephrine from sympathetic nerve ending, leading to decreased blood pressure. Therefore, the correct answer is E. Alpha-methyl adrenaline, on the other hand, is a non-selective adrenergic agonist that acts both alpha-1 and alpha-2 beta-1 receptor. While it has some affinity for alpha-2 receptor, it is not considered a specific alpha-2 agonist like other drugs listed. How the side effect of quinidine: hyperthyroidism, synchronism, high blood pressure, sugar increase. The correct answer is B, synchronism. Why? The potential side effect of quinidine use. Synchronism is a group of symptoms that result from an overdose or prolonged use of quinidine or other drugs that contain quinine-like substance, such as quinine or chloroquine. Symptoms of synchronism may include ringing in the ears like tinnitus, hearing loss, blurred vision, headache, confusion, dizziness, nausea, vomiting, diarrhea, abdominal pain, sweating, flushing, skin rash. Severe cause may lead to cardiac arrhythmia, seizure, and even death. Synchronism is a relatively rare side effect of quinidine, but it can occur with high doses or long-term use. Patient taking quinidine should be closely monitored for symptoms or synchronism. Another side effect: if you experience any symptoms of synchronism or other side effect, you should contact your health provider. 4. About digitoxin, which is false. A. Oral bioavailability 100%, protein binding 95%, half-life is 7 days. D. Mainly affect hepatic metabolism by microsomal. The correct answer is oral bioavailability 100%. Digitoxin is an orally administered cardiac glycoside used for the treatment of heart failure, cardiac arrhythmia. However, its oral bioavailability is not 100%, which means not all the drug taken orally reach that bloodstream. The oral bioavailability of digitoxin is about 80%. The other statement about digitoxin are true. The digitoxin has high protein binding capacity, approximately 95% of the drug being bound to plasma protein. Its half-life is long, approximately 7 days, which means it has long prolonged effect and require careful monitoring the blood level. Digitoxin is primarily metabolized in the liver by microsomal enzyme. It is very important to note digitoxin is a potent medication that requires careful dosing and monitoring. If you have any question or concern about digitoxin, you should need to consult your doctor. 5. Volatile substances given by inhalation. A. Cyclophosphamide, B. Fluorouracil, C. Doxorubicin, D. Cisplatin, E. Halothane. Correct answer is E. Halothane. Yes, halothane is a volatile substance that is given by inhalation for general anesthesia. It is a halogenated hydrocarbon that produces a rapid induction of anesthesia and has a relatively low blood pressure gas partition coefficient, which means that it is quickly eliminated from the body after inhalation is stopped. Halothane is one of the earliest inhalation anesthetic. It has been widely used in the past for both induction and maintenance of anesthesia. However, its use declined in recent years due to availability of newer and safer anesthetics. Despite its effectiveness, halothane can be associated with several side effects and complications such as hepatic toxicity, hypotension, arrhythmias, malignant hyperthermia. It is important to carefully monitor a patient receiving halothane. To compare between two drugs, use physical appearance, weight, comparing bioequivalency, pharmacokinetic parameter, pharmacodynamic parameter, or taste. The correct option is D, pharmacodynamic parameter. which include the study of how the drug interact with the body or produce its therapeutic effect. The parameter can be used to compare the efficiency, safety, side effect of the drug. The other option like physical appearance, weight, taste are not reliable parameter to compare the drug efficacy and safety or pharmacokinetic. More detail, physical appearance, this parameter can be used to differentiate between different formulation of the same drug, compare different drugs that have distinct physical characteristics such as color, shape, size, structure. However, it is not a reliable parameter to assess. Weight in comparing bioequivalency, if drugs are intended to have active ingredient and have been shown to bioequivalent, their weight can be compared to ensure that the amount of the active ingredient are same in each drug. Pharmacokinetic parameter include the study of drugs absorption, distribution, metabolism, excretion in the body. These parameters can be compared to determine if the drug has similar pharmacokinetic profile or the same side effect or similar effect. Taste. Although the taste of the drug can impact patient compliance adherence, it is not a reliable parameter to compare the drug efficacy and safety. Number 7 about side effect of oral contraceptive except A. Depression, B. Hypertension, C. Constipation, D. Weight gain, E. Menstrual changes. Correct option is C, is not the side effect of oral contraceptive. Oral contraceptive, also known as birth control pill, can have various side effects, but constipation is not the one of them. We can go through depression. Some women may experience changes in their mood, including depression, anxiety with taking oral contraceptive. Hypertension, oral contraceptive can increase blood pressure in some women, especially those who have history of high blood pressure. Other side effect, nausea, weight gain, changes in menstrual. However, it's important to note that all women will experience side effect from oral contraceptives. Some side effect may go after a few months use. If you consider taking oral contraceptive, you must need to consult your doctor before. Drug used in ventricular arrhythmia: A. Phenytoin, B. Quinidine, C. Digoxin, D. Procainamide, E. Verapamil. The correct option is procainamide, D. Ventricular arrhythmia is a type of abnormal heart rhythm that originates in the ventricle, the lower chamber of the heart. It can be a serious condition that require medical treatment, including the use of drug. Here are the drugs commonly used in ventricular arrhythmia. Phenytoin, this drug is anticonvulsive that is not typically used for anti-arrhythmia. Quinidine, this drug is an anti-arrhythmiatic that can be used to treat ventricular arrhythmia but is not considered the first line treatment for it. Digoxin, the drug is cardiac glycoside that is used to treat heart failure, not ventricular arrhythmia. Procainamide, anti-arrhythmiatic, that is commonly used to treat ventricular arrhythmia in emergency condition. Verapamil, the drug is calcium channel blocker that is typically used for the ventricular arrhythmia. Question 9. Intolerant patient need more dose of obtain the same effect. A. The drug become equal responsive to a body. The drug become more responsive to a body. The drug become less responsive to a body. The body become more responsive to a drug. The body become less responsive to a drug. The correct option is E. The body become less responsive to a drug. Tolerance is a physiological phenomena where the body becomes less responsive to a drug over time and higher dose is needed to achieve the same effect. Tolerance can develop many drugs including opiates, benzodiazepine, stimulants. It's often seen in patients who use these drugs chronically or can lead to a dependence and addiction. Today's last question, cause of hypothyroidism. Low pituitary hormone, low hypothalamus hormone, iodine deficiency, or the all of the above. The correct answer is D, all of the above. Iodine deficiency. Iodine is an essential nutrient which is needed for production of thyroid hormone. In areas where there is a low dietary intake of iodine, hypothyroidism can occur. What is hypothyroidism? It's a condition where the thyroid gland does not produce enough thyroid hormone. Autoimmune thyroiditis. This is an autoimmune disorder where the body immune system attacks the thyroid gland and leading to damage of the thyroid gland and by this decrease the production of thyroid hormone. Let's talk about treatment of hyperthyroidism. Certain treatment for hyperthyroidism such as surgery or radioactive iodine therapy can lead to hypothyroidism. Congenital hypothyroidism, that is a rare condition where the baby is born without a functioning of the thyroid gland or a poor function of the thyroid gland. Pituitary or hypothalamic disease, these are the conditions that can affect the pituitary gland of hypothalamus which are involved in the regulation of thyroid hormone. So the correct option is D. Thank you so much for watching this video. I hope you found it informative and helpful. If you have any question or suggestion for more future videos, please don't hesitate to leave a comment or send a message. And if you enjoyed this content, please consider subscribing to my channel and turning to the notification bell so you don't miss out any future videos. Remember, taking care of your health is one of the most important things you can do yourself. Thanks again for watching. I will see you in the next video.